Assalamu alaikum. My name is Amna Iftihar. The topic I am going to describe is methamphetamine, that is also known as ice. What is methamphetamine? It's man-made, powerful, and highly addictive stimulant that affects the central nervous system. Its other names are meth, chalk, ice, and crystal. It is mostly produced commonly using the ephedrine and pseudoephedrine by reduction method. Meth is commonly manufactured in illegal hidden laboratories, mixing various forms of amphetamine or its derivatives with other chemicals to boost its potency. Meth is highly addictive drug made from a variety of toxic ingredients. Its chemical uh, formula is as it consists of a benzene ring, two methyl group, and one NH group. It is mostly in the form of the crystals. History. First synthesized in 1893 by Nagayoshi Nagel, but went unnoticed until it became the alternative to ephedrine as a drug commonly used to treat asthma. It was used in Japan, Britain, Germany, and the US during the World War II to enable soldiers to stay awake and alert and compulsively focused. It was widely used during World War II by Nazi and Japanese armies. Japanese kamikaze pilots were documented to be highly on meth. Then biker gangs in California started after World War II began to distribute meth. Its history is given as in 1893. It was synthesized in 1932. Its other form, that is as an inhaler, it was discovered as benzedrine and it was used. In 1939, soldiers used meth during World War II to improve endurance. In 1950s, negative effects of meth are well known, but benzedrine abuse is common. In 1959, FDA requires prescription for benzedrine. In 1970, meth becomes illegal in the US. Then in 1980, ephedrine regulations increases and illegal meth is made with pseudoephedrine instead. Then between 1994 to 2004, meth use grows from 2% of the US population to 5%. In 2005, Congress passes the Combat Act. In 2006, who declares meth the most abused hard drug on earth. In 2012, prescription stimulant use explored. 60 million adult prescriptions are written. In 2014, meth overdose deaths more than doubled from 1,400 to nearly 4,000. In 2017, meth is the greatest drug threat reported by 30% of the agencies in the 2017 National Drug Threat Survey. But in 2018, meth seizures at the border tripled between 2012 to 2018. Next, how it works. It releases large amount of dopamine in the brain, causing a feeling of pleasure and euphoria. How it works. Here, we feel the pleasure when you are in the reward pathway that is shown by the arrows. Release a neurotransmitter called dopamine into various brain areas. Now, what dopamine will do? Dopamine in the reward center is released into the gap that is called synapse between the neurons, crosses to the next neuron and binds to the receptor, providing a jolt of pleasure. As a result, we feel highly. That is a high feeling of pleasure is feel after taking ice. How it is used or how it is taken. It can be smoked, injected, snorted, or it can also be ingested. Now, there are three types. First one is powder, second one is base, and third one is ice. First, powder is also called as speed. It is 10% pure, means it contains 10% methamphetamine, usually snorted or injected. Second one is base. It contains 20% methamphetamine and usually swallowed. It's also damp and oily. Third one that is mostly used is of high purity, that is 80% methamphetamine it contains, and is also known as crystal meth and ice. It is mostly smoked or injected. Now, ice is the most potent and pure form of methamphetamine. Now why most people take ice? To fit in or to feel a part of social groups, mostly the elite class uses this to reduce inhibition and increase confidence out of curiosity or to experiment. Next is to manage mental health issues and the impact of trauma Next is to cope with problems like unemployment, stress, poverty, to escape reality out of boredom. And some people do it, like some artists do it, to enhance work performance and to enhance sexual experiences and intimacy. What's going on with ICE? Mostly 70% of the users are occasional users, 30% of the users are regular users, 10 to 50% use weekly or daily. The heaviest user of this drug are 20 to 29 years of old. Its use is high in those who are already engaged in drug use, unemployed, and live in regional and remote areas. Now, why its use is increasing? Because price of ice is decreasing, high purity of drug is available. Also, its high levels in wastewater. How it works? Ice trigger the release of brain chemicals or neurotransmitters. Three brain chemicals that are released are dopamine, serotonin, and noradrenaline. These chemicals are responsible for making us feel excited, alert, and euphoric. Now, dopamine is responsible for pleasure, motivation, attention, memory, and planning. Noradrenaline is responsible for arousal, mood, attention, fight or flight. Serotonin is responsible for mood swings, sleep, cognition, perception, and body temperature. Next, all methamphetamine forms quickly raise and sustain levels of the brain in chemical messengers, particularly dopamine, which is responsible for memory, attention, etc. Methamphetamine release between 450 to 1200% more dopamine in your brain, which can help explain why some people like this drug so much. However, Newton's law of gravity tells us what goes up must also come down. So while people may feel like they are the king of the world while they are high, when the drug wears off, they will feel the total opposite. Low mood, exhaustion, and irritable. Uh, in When we take methamphetamine also releases high amount of noradrenaline, which mobilizes the brain and body for action and essentially activates our fight and flight system. At high doses or through the prolonged use of the drug, we can experience an increased threat potential and can become anxious, jumpy, hypervigilant, and suspicious and aggressive mostly. The drug also releases elevated amount of serotonin in brain. Increased serotonin means people are likely to experience an elevated mood, body temperature, and also stay awake for longer. In this case, we feel hyperactive mood swings. If a person doesn't have enough serotonin, they are likely to feel that flat and depressed after the effects are out. People who use meth will often spiral into something called binge, in which they become hyperactive and repeatedly dose with methamphetamine in hopes of maintaining the initial euphoric high. This uncontrolled drug use will often decrease its potency, however, making achieving the high impossible. Many users continue to seek lines of meth to attempt to obtain the same high. Eventually, a user will stop experiencing the high and tweaking begins and making a user feel emptiness and unease. Many people testify to feeling a loss of identity during this time. It is very dangerous. It is common for the users to experience hallucinations and extreme itchiness. Addicts at this stage are at high risk of self-harm. So, what are its physical effects? The physical effects of ice can last between 4 to 12 hours, and ice can leave the body after 1 to 2 days. Now, using this can also increase mortality risk related to overdose, natural diseases, suicide, and accidental injury. Now, there are two types of effects. First one is short term and long term. In short term, it includes headache, uh, dilated pupils, blurred vision, insomnia, clenching, jaw clenching, increased attention, alertness, trembling, stomach cramps, reduced appetite, increased heart rate, increased breathing, sweaty and clammy skin, dehydration, increased energy, and changes libido. While in long term, it's stroke, dental problems, dependence, poor concentration and memory, increased risk of hepatitis C and HIV in injecting users, heart and lung problems, chest pain, kidney problems, kidney failure, malnutrition, weight loss, exhaustion, and movement problems, etc. Now, there are two phases. First one is calm down phase. Second one is withdrawal phase. Calm down phase is experienced when eye starts to wear up. Its symptoms are feeling down, depressed, decreased appetite, exhaustion, increased need for help, sleep, irritability, and feeling anxious. Withdrawal refers to the unpleasant symptoms experienced by the people who are dependent on eyes, headache, anxiety, uh, uh, aggression, restlessness, cramps, and vomiting. Now, next is mental health effects. Some people, the symptoms experienced while using ice or during the calm down or crash phase persist and develop into mental disorder in their own way. It includes psychosis, insomnia, anxiety, poor memory, damage to the attention span. The side effects of use are signs of anxiety, signs of depression, and signs of psychosis. First is signs of anxiety: restlessness, dizziness, trembling, sweating, dry mouth, nausea, vomiting, etc. Now, the signs of depression. People who use the drug regularly can experience depressive symptoms when they are not using ice because it can deplete brain chemicals which are responsible for making us feel happy, excited, and high. Signs of psychosis: feeling suspicious or paranoid, hallucinations, unusual thoughts, repetitive compulsive behavior, muddled thoughts, or incoherent speech include in signs of psychosis. You may become psychotic if you continue to use these drugs. Now, the types of treatment available here include withdrawal management or detoxification programs, stimulant treatment programs, counseling, outpatient, residential rehabilitation, online and phone counseling, youth-specific services, Aboriginal specific AOD services, mental health services, self-help support system, family support, or therapy. Pharmacological treatment. Currently, there is no magic pill or any drug-based treatment available to treat the ice dependence. Managing the symptoms of withdrawal detoxification through medication may be helpful. Brief psychosocial treatment seems to be most effective in treating people who are dependent on ice. That's all from my side. Thank you so much.